is Kristen Lancaster. I'm going to do your advanced abdominal exam. Can you please pan the room as I wash my hands? And as you pan the room, I'm going to go ahead and start talking about the correct order for a typical abdominal exam, which would be inspection, auscultation, percussion, light palpation, moderate palpation, then deep palpation. But if you came in with a complaint of abdominal pain, then we would reserve percussion and palpation to that area last to minimize guarding. So then we would inspect for and look for Cullen's sign, which is ecchymosis around the umbilicus. If we noticed any bruising around the umbilicus, that could indicate acute pancreatitis, or if he was a female, ruptured ectopic pregnancy. So then we would look for Gray-Turner's sign, which is ecchymosis on the flank area. If we noticed any bruising on the flank area, that could also indicate acute pancreatitis, but also could indicate retroperitoneal bleeding. So then we would look for abdominal distension. Some causes of abdominal distension would be fluid, a full bladder, feces, flatus, or fatal tumor, anything of that sort. So then we would auscultate his bowel sounds in all four quadrants with the diaphragm. So, absent bowel sounds could indicate an ileus or peritonitis, and hyperactive bowel sounds could indicate gastroenteritis or a GI bleed. And if you hear a high-pitched tinkling, that could indicate an obstruction. So then we're going to turn our stethoscope around to our bill and auscultate the abdominal aorta. For any bruits noted could indicate a aortic aneurysm. Then we're going to palpate the aorta. So if we noted a pulsatile mass or a aortic diameter of greater than 3, that could also indicate aortic aneurysm. So then we're going to move on to inspecting the liver. So we're going to percuss down at the midclavicular line. We're percussing for liver span. So we're going to start by percussing down for the top border, and as we're percussing, when it turns to from Tiffany to dull, we're going to mark for the upper border, and then we're going to percuss down up for the lower border. And normal would be about 6 to 12 centimeters. So we're gonna take our tape measure and measure, and his is about 9 centimeters. So then we're gonna do the scratch test, which is we're gonna put our the diaphragm of our stethoscope at the xiphoid, and we're gonna scratch up until the sound becomes louder. Then we're gonna mark it. And then we're going to scratch up from where we marked, which is the lower border. And mark it again. We're scratching until the sound goes back quiet or less loud, which is the upper border of the liver. And then we're going to measure it again, and it should be about 10 centimeters, and his is exactly 10 centimeters. So then we're going to do deep palpation of the liver. So I'm going to ask you to take a deep breath in for me. All right. So I should only feel at most the liver border. I should not feel more than the edge, or I shouldn't feel any rigidity or irregularity in the liver shape that could indicate liver abnormality. So then we're going to test for ascites. So we're doing the fluid shift test, or the fluid movement test. I'm going to get you to put your hand like this right in the middle of your abdomen. There you go. I'm going to take this hand and I'm going to tap on this side, on his left side, and then I'm going to palpate on his right side. If I notice any fluid shift while palpating on his right side, that would indicate ascites, and I would do the same thing on the other side, and he is negative for ascites. So then we're going to do the Murphy's test, which is you would deep palpate in the same place you would palpate for the liver. So take a deep breath in. If he abruptly stopped as he was on an inhalation, as I was deeply palpating, that would indicate possible inflammation in his gallbladder, and that would be a positive Murphy's sign. So then we're gonna percuss for the spleen. So we're going to find the lowest intercostal space down the anterior axillary line. And we are going to percuss, and it should be resonant. So then I'm going to ask you to take a deep breath in and hold it. All right, let it go. So if he had an enlarged spleen, as I was percussing, when the spleen dropped down or was pushed down from the lungs under my finger, the percussion would turn to from resonant to dullness. So then we're going to do deep palpation of the spleen. So I'm going to ask you to take another deep breath in for me, okay? All right, so I should only note the borders of the spleen, the edge of the spleen. If I noted any more, anything further than the edges, that would indicate an enlarged spleen. So then I'm going to get you to roll onto your right side for me. Got it? So we're going to do the same thing again. So take a deep breath in for me. Let it out. Same thing, if I noted more than just the edges of the spleen, that would indicate an enlarged spleen. All right, you can turn on your back. So then we're going to test for peritoneal inflammation. So we're going to do the McBurney's sign first. So we locate the umbilicus, and then we also locate the anterior superior iliac spine. There we go. And then we go about 2/3 of the way down And then we palpate for any tenderness or pain. Any tenderness or pain in the lower right quadrant could indicate appendicitis. So then we are going to do the Rovsing sign and rebound tenderness at the same time to check for appendicitis. So for the Rovsing sign, we're gonna slowly push down and ask him, does he feel any pain in the right lower quadrant? Do you feel any pain? If he did, that would be a positive Rovsing sign for possible appendicitis, excuse me. Then we're gonna quickly lift our hand. Did you feel any pain in the right lower quadrant?
No.
So rebound tenderness is as we're lifting our hand. If he had rebound tenderness, he would feel pain in the right lower quadrant. He does not. So then we're going to do the psoas sign to test for appendicitis, excuse me. So I'm gonna apply resistance to your right leg, and I want you to lift against my against my hand, excuse me. If he feels any increasing, okay, you can let it down. Any increasing pain or tenderness in that right lower quadrant as he's lifting the leg, that would be, that can indicate appendicitis. And then we're gonna do the arbitrator sign. So we're gonna lift your leg to 90 degrees, and we're going to rotate his ankle laterally, and then rotate his knee medially to rotate that hip medially. And as we're doing that, if he feels any pain in his right lower quadrant, that would also indicate appendicitis. All right, I'm gonna get you to sit up for me. All right, and turn your back towards me. So we're gonna check for kidney tenderness. So we're gonna locate the costovertebral angle. Take a deep breath now for me. Okay, there we go. All right, so it's about right there. So we're gonna lightly tap on each side. If he had any pain or tenderness while tapping, that could indicate pyelonephritis. Thank you.